in general surgery and a colorectal fellow at several local hospitals, namely UKM, and Hospital Selayang. As if that's not impressive enough, she also served as a colorectal fellow overseas at Chulalongkorn University, Bangkok, Thailand, and Korea University Medical Center in Seoul for almost 2 years before returning to Malaysia, specifically to Sarawak General Hospital as a consultant general and colorectal surgeon, as well as to UNIMAS as a senior medical lecturer and consultant general surgeon of Department of Surgery. With over 9 years of experience as a surgeon locally and abroad, as well as an astounding 11 and counting years of service as a surgical specialist, please join me in welcoming our distinguished panel, Associate Professor Dr. Hajah Aini Fahriza binti Ibrahim. The floor is yours.
Thank you so much, Atira. Now, sorry guys, sometimes the hospital is going to call me. I just... Okay, let me share the ni. Boleh, I can share the ni. Okay. Can you see this? Dapat mana aku ni?
Boleh dapat.
Dapat kan? Oh, I just know them. I mean, what do? Apa tak dapat? That's my fault. If I stop my video, my presentation will stop as well, is it? Tak? Can't remember.
Tak ada doktor. Dia still dapat result.
Why can't I? Tak ada. I had a big operation in Norma tadi. But patient is in pain, so every time patient in pain, they will call me, so the phone will be like ringing all the time. Tapi tak apa, they will do this. Okay, good evening, everyone. I think I met some of you. I might not meet some of you. All right. So my name is Dr. Aini. I am actually one of the lecturer in the surgical department of UNIMAS. And currently I'm practicing colorectal surgeon in few hospitals in UNIMAS itself, in SGH, and also in the private center. So now, when you guys came up with this topic, all right, sometimes it's a bit hard for me to say, because I didn't actually choose surgery as my first pathway. I mean, first choice, because initially when I went to, as what Atira said just now, I went to a medical school in Galway, so I had a very good ONG specialist. So she actually encouraged us to do to take up ONG, and then. But then I'm not sure what happened down the line. I'll tell you the story later, and then why I've changed totally to surgery, and then suddenly how I ended up doing a colorectal surgery. Okay. Now, any of you has parents or brothers who are in surgery at the moment? Anybody?
So far, no doktor.
Tak ada anybody
Tak ada.
yang tengok kehidupan dia macam mana? Tak ada. Okay, tak apa, right? So I think the best thing is to experience somebody's life, right? To see, because if not, people always say, oh, it's a busy life, it's hectic life. Yes, but there are also times when we enjoy what we do. And then first and foremost, of course, we have to enjoy what you want to do actually. First of all, before this went to medical school, you were asked about why you want to become a doctor. So you have all the answers, right? But now if you want to do surgery, you have to ask yourself before you answer people's question, why you want to be a surgeon, right? So people will come up with various, very best answers. So, it's entirely up to you, right? No, it doesn't, because this is what actually you want, right? Nobody forced you to become a surgeon. Some people become a surgeon because they're influenced by, I'm not sure whether you know this, Dr. Romantic. It's very famous, one of the famous Korean drama in hospital called Hospital Doldam. This is like hospital middle of nowhere in Korea. So this surgeon, he can do everything, right? So some people wants to be like that, all right? And he can do everything under the sun. Then we also have doctors who wants to do charity work, right? So if some of you definitely watch this Descendants of the Suns, right? This is a lady surgeon who went to work as a charity doctor in Greece, I think, at that time. So people have various aim why they want to become a surgeon, and then also various kan aim, what was it, macam not aim, what do you call that, various ambition. I mean, why they think, some people feel that, oh, the name is very tough, very up to very comparison to other specialty, but it's not actually. It's the same as any specialty. Now let me tell you about my journey. I think this is more interesting than if I want to tell you the career pathway in Malaysia. Okay, of course, I was born in Kuching. I studied in a school in Kuching itself, in one of the secondary school. Some of you from Kuching, do you know where the school is?
Yes.
Huh? Siapa? Sekolah mana? Siapa
Dekat
jawab?
dengan waterfront.
Huh? Initially it was an old building. This is a new building. Tapi then now initially they wanted to move to a new place. But I think some problem with the land and whatnot, so they're still there at the moment, right? So like 22 years down the line, no, 22. Oh, actually more. I mean, like nearly 30 or 27 years down the line, the school is still there, right? So I went there from Form 1 until Form 5. Now, after Form 5, what happened is last time we had what we call Borang UPU, where you fill up to go to further study. So you can choose that masa tu. So I got into the program to do medical in UK. So they call it PETOK, Program Penghantaran Terus United Kingdom. So United Kingdom, not doing any basic here. We had some English prep, and then in 1996, so I went to school in UK. So we call it A levels, but actually it's a school. But the other this thing called, the system UK, the Form 6, which is actually sama juga lah, macam dekat Malaysia, Form 6, but this is what we call A level, advanced level. So at this time, A level was still 2 years, right? Comparison to in Malaysia, all my friends who are doing training, matrix, are doing 1 year. So actually I entered medical school later than some of my counterparts. Then so after 2 years of A level, and then 1998. So if you remember, in 1998 it was academic problem. I'm not sure. Dah lahir ke belum Dah lahir belum? Okay, tak apa, belum lahir, right? So because I don't think your parents even met yet, right? So economic problem. So initially we all supposed to come back. Now after 2 years, we're supposed to come back and then continue medical school in Malaysia to then have to apply, right? But then I was ready to come back because masa tu it was so expensive to go over. Was like 3, 4 times, 8 times the British pound. So nobody has money. People went bankrupt or whatnot, right? So we're supposed to come back home, but then the government was nice enough at the end to get a place for us to study in Ireland. Ireland masa tu masih guna Irish pound, so a bit cheaper. And then after medical after couldn't get into medical school in UK, so they got placed in Galway. So if you know, Galway is actually west of Ireland. It's very, very far. It's like hujung dunia, memang hujung dunia. If you nanti I show you the Irish map, it's at the end of the other side. It's nearer to America than to Europe, right? So and then this is what we call a 5-year program. Actually 6 years, but I went into the young compressed one, so 5th year until final year. So I went there for about 5 years, and then after that I got into housemanship in Ireland, and then we go into basic surgical training for 2 years in Ireland. This is actually where it started. Actually, initially, during housemanship, because I have such great surgeons, and one of them is this orthopedic surgeon, spine surgeon, Mr. McKim. The other one is Mr. Vascular surgeon, Mr. Sharif Sultan. They're still there. They're so good. I'm not kidding. So I think maybe they are the one who influenced me to do surgery and give me place to start. So in some point of the career, there must be something happen that makes you choose to become a whatever specialty you want to become. That's what happened to me, right? So I went to medical. I went for the training for 2 years. Over there, we call it basic surgical training for 2 years, right? So this is the hospital, which is my university hospital, and also hospital that I work as a houseman, and also as my training partner, right? Still there at the moment. Then some of my training during my basic surgical training is called Sligo. I'll show you the map. Sligo ni tempat Westlife. Tahu tak siapa? Kenal tak Westlife? Zaman korang ke bukan? Kat zaman bapak korang.
Kapan Bapak?
Zaman bapak, yeah. So Westlife, they're very famous. So they're from Sligo. So I treated one of the Westlife family before in this hospital. All right. So this is the middle of Ireland. So I had a good training there, had lots of good surgeons there, right? So you can see, I tak boleh guna ni. Tak boleh guna. I tak boleh guna ni. How do I use? How do I use ni, PowerPoint. Okay, tak apalah. You just look. Okay, Galway is more towards the left side, and then Sligo is in the middle. I actually did also work near Londonderry up north, right? And then multiple places in Ireland, Dublin, went to Cork. So actually during my training, I went all over Ireland to work, right? So this is one of the sacrifices that you have to do, even when you if you decided to do any surgical training or medical training, you have to be hantar ke mana-mana, right? This bread and butter of training. So, but Ireland ni tak besar sebenarnya, dia kecil je. Then what happened was in 2005, 2006, my late father was not well, and then there's nobody at home. There's only two of them. So I decided to come back home and join UNIMAS as a trainee lecturer. I applied online, right? So when I did that, so I entered the surgical department, and then as a trainee lecturer, and then started my masters of surgery for actually 5 years lah. I had it. Repeat 1 year in University Kebangsaan Malaysia. So my general surgical masters is from USM. UKM, right? Now, so basically after you've done your masters of surgical training, which is that you become specialist, right? Then I came back to Kuching. I did my gazetteman, all right? And then UNIMAS said that I have to learn to become a teacher. So actually, kenapa tak dapat my cursor? So what happened was my UNIMAS asked me to do postgrad diploma in teaching and learning so that I can teach you guys, all right? So I did that for a year, and then so the pathway was a bit longer. That's why I said in comparison to some other people had it much more shorter. And then after that, in mid 2016 until 2019, baru I went for my colorectal fellowship, right? This is a 3 years program. It's a national program. So whereby I went again back to UKM. I went back to UM. I went to Selang Hospital. And then the last hospital was I went to Bangkok for Chulalongkorn. And also before COVID, I was in Korea for about 6 months, right? And then I came back in 2019, and 2020 was COVID, right? So I've been in Kuching since, right? So I haven't been. So it's quite a long journey, right? So for some people, dengar benda tu pun they feel that, oh my God, you know what the training program. But unfortunately, that's how the what we call the subspecialty is, right? So some people, some of my friends even ended up in just becoming a general surgeon because they don't want to do so many of this sacrificing, because you have to go all around, right? Especially if you have family, memang susah. But then, you know, I was single, so, you know, I had nothing to worry for, right? So before this, when we did the training, we didn't ever have any definite curriculum. But now they understand that for people like you guys, for you to understand this, why don't we put it in paper, right? So they came out with the national training, surgical training in Malaysia. All the consultants came out with this prospectus, this syllabus. What is general surgical postgraduate training in Malaysia? This is just in Malaysia lah, huh? Because we do have people who did their training overseas and they came back as a specialist ada juga, right? So general surgery, I think some of you know, is very specialized into bowel problem, GI problem, breast endocrine vascular, and then sometimes also we do polytrauma. But polytrauma now is more in emergency. Then we have to be, you know, multitasking, and then you have to know also some medicine part of it. And then now what happened in general surgery is there were lots of apa tu? Subspecialty. So sekarang ni macam if you notice, people are doing just breast, just doing thyroid, just doing upper GI, just doing colorectal, or just doing uro or whatnot, right? So very, very special time. And then they decided, okay, look, we put it this way. So there's basically 3 training program, right? Number 1 is the basic surgical training. This is like what I did last time in Ireland. So it's normally about 2 years, right? And they have some syllabus that you can follow through. Then baru you pergi your advanced training, which is when you enter your masters, for about 4 to 5 years or a maximum 7 years. And then once you finish this, then if you decided to higher surgical training, which is a specialty, you can go for the clinical fellowship. So basically, it's at 3 stages. Now, why do we have to do all this? Same thing, you know, we have to have objective because we have to start somewhere, right? So basic training normally is just for the basic competency, basic surgical procedure, basic knowledge. And the advanced training is where you become, or I'm getting ready to become a surgeon, right? Whether I can do all this on my own. And whereby in the higher training, it's like you can do most of the general surgical training, but I want to do more. I want to do much more deeper that other people can't do, right? So this is the difference. So they divided into these three things in these 3 groups into different courses that they should attend at least lah kan, because the courses are related to the years of training. So macam-macam lah you dengar, some even basic life support, trauma support, all right, care for critically. This is all the courses to enhance your knowledge or in surgical management of patient, right? Then once you're into your masters, then you will start to have all these various courses that you have to undergo, the middle part, the advanced part. And then when you go for higher, so higher is much more flexible in the sense that it's according to your trainer and the syllabus of each subspecialty, right? And then some also different subspecialty and the different types of management syllabus. Okay. Now, so what happened? So once you finish your medical school, then you become houseman for 2 years, right? So bila once you become houseman, you nak dapat posting. So whichever lah, normally you get medical posting, surgical posting, whichever you get. So normally, if people wants to do Masters of General Surgery, so they at least will choose people who actually know surgery after houseman, right? Because housemanship, you don't not internship, you're not going to see so much anyway. So once you become more MO, you can manage these people independently, and hence the minimum 2 years of service. And then you have this SKT that you need to achieve as well, and also some recommendation from more consultant. Then this from the MOH, because most of you will go under MOH. You have to understand, I never joined MOH. I'm under UNIMAS. So UNIMAS is Kementerian Pengajian Tinggi, is KPT, right? So from the university requirement, so you have to be at least memang you doctor lah kan, and then you have to have full registrationship with MMC. So that's why you have to wait after the 2 years of housemanship. Then other merits, for example, you have scoring, English scoring, if you're not from English, from university where English is not the medium. You also had some attachment in Malaysia if this candidate are for international. We do have that, right? We do have that. And then for people that candidate that what I did last time, basic surgical training in overseas, at least that is one of the requirement as well, right? So normally they will go through the website now. Normally I think it should be completed by now. July is of each year. And then if for the private or overseas, they will apply online directly to the each university. And the screening application will be done by a conjoint committee. Like ramai orang akan in surgical will have a look at it, and then they will call them for interview January normally, and January, and then the result will be out by April, and then they will start their training normally in June, right? So training session semester starts in June for general for all specialty in Malaysia, right? So how do you assess whether you good or not in terms of the surgical aspect, right? Same as your medical school. You know, these 5 years, you have multiple level of topics, isn't it? And then assessment of each topics are different, right? For example, kalau dulu you ada OSPI for your preclinical, but in clinical you have OSCE, and then in clinical you have short case and long case, right? And then you have modified long case or whatnot, right? So all these assessments are modalities to assess the competency of this of you guys in medical school. Same as in surgical, because the doctors cannot be like the trainer lah kan. Tak boleh lah nak tengok setiap candidate buat operation every time. Mana ada masa, right? So they have to have certain procedure-based assessment that they can need to follow through. They have also docs, which is direct observation of skills. They see one, do one, or maybe they teach one, right? They also have clinical evaluation, case-based discussion, and also other professional courses as what mentioned before, right? But in Masters of Surgery, because this is basic surgical training ni macam nak just to get ready for you to the Masters of Surgery. So Masters of Surgery, the walaupun di 4 years, but each year has its own assessment. And then, but the most important is the final year, where we call it exit exam, right? Exit exam to sign you off lah as a surgeon. So this one will be sama juga, will be writing, will be a written exam, and also clinical exam, short case and long case normally, right? And some people will also have some thesis. No, I think most people will have thesis. So if you pass all this, then you can be qualified as Masters of General Surgery. Actually, it's equivalent to PhD, pasal 4 tahun. So then hence you are given the certificate based on university that you enroll in, right? So now in Malaysia, that Masters of Surgery are offered by UKM, USM, UIA, UPM, or start. What else? I think those are the ones at the moment, still very new, right? So your certificate will be coming from all these universities, not from the KKM, right? KKM is just a training ground, right? So I think that's like the whole gist in short, like in summary, how to understand the training pathway in Malaysia. And then this is all under the National Postgraduate Training Syllabus. And then, but of course, I have to tell you, it's not easy, right? This, it's quite lengthy, all right? And I do understand why some people, feel that, this, daripada you buat susah, actually at the end, you're still going to work hard until bila-bila pun. Some people opted not to choose surgery, but those people who really likes it, please, go forward, try to learn as much as possible. Certainly we need more surgeons than or other specialties at the moment. Okay. I think that this is, as I said before, is a criteria to become a specialist, right? And then it all depends on the final exam. Sama juga macam the final professional. It's all about your final exam. So that's the most scary part, right? Part 1 and part 2. Okay, so this is the general procedures for specialists, right, in surgery. Very, very basic, right? And if you go for the fellowship, they are much more intense. So they assess according to what cases the doctors have done. Okay, I think that's about it. I keep it short because I feel it can the training can change over time in terms of maybe they will fine tune some certain things, right? But in general, this is how is it done? How is it done here? And then, of course, that's why we say this is in Malaysia. You can't compare it with any other places because different countries in the world have different types of training, right? Because even when I was in Bangkok, in UK, in Ireland, in Korea, these people are they enter right after housemanship. They're very, very junior, right? You see all these people, memang the young, we call it the young surgeons, comparison to us here, whereby our pathway is much more longer. Okay? All right. I think that's about it. Maybe then we can definitely open the floor to the questions.
Okay, thank you, Doctor. Thank you very much, Doctor, for the meaningful sharing. I hope future surgeons among our audience today can have a much better, clearer idea on the pathway of becoming a surgeon. Now, I would like to open the floor for any burning questions from the audience. Feel free to introduce yourself, unmute your mic, or leave your question on the chat box. In the meantime, I have a question. I was curious because you served at Thailand and South Korea, right? For your fellowship. I was wondering how does language barriers work in that sense? Do you face that challenge when you were doing your trainings overseas?
Okay, so as you know, in Chulalongkorn University in Bangkok is a very well known. It's actually a private university. So private university, private university, most of the students are quite well-to-do, quite rich, and then most of them have international exposure, right? So most of them speaks English. So I think that's why it was very, very easy, and that's why the university they train the colorectal system, colorectal surgeons there. The unit opens up the unit for international trainees, and then we have so many trainees that comes to Chulalongkorn, and one of especially in colorectal. one of the best place to train, especially what we call proctology, or actually everything is actually Chulalongkorn. Memang it's different experience when I had my training. Oh,
I
and
see,
then
I see.
sorry, and so that's in Bangkok, right? Then I went to Korea. So again, if you know, you guys know what SKY, SKY, macam Ivy League of university. SKY is the top 3 universities in Korea. Ada 7 drama about it, right? So equivalent to macam ni lah, the Ivy League of US. So the top 3 universities in Korea is, so SKY, okay. Y is Yonsei University. K is Korea University, Korea University, and S is Seoul National University, right? Out of this, Seoul National University is actually public, right? The other 2 are private, funded by companies or whatnot, right? So when I applied to Korea University, I applied to the surgeon, Prof. Kim So-han. Prof. Kim So-han now is working in UM. So he's one of the robotic surgeon. He's trained overseas, he's trained around the world. So people goes to him because the training is very good. So when I applied to him, people applied to work to train with him, whichever university that he is in. Previously, he was in other universities. So it just so happens when I applied, it's even a year before me, he joined Korea University, right? As a surgeon. So that's why when you apply to him, you're automatically gonna go into Korea University Hospital, right? So that's why I ended up there. And then because it's a private and it's lots of people that has international exposure, same as Chulalongkorn, I never had a problem, right? Because the people speaks English, and then one of my partner in crime, Prof. Yunmi Park, which actually a Korean British citizen. We were working together, so she's the one did most of the translation for me during the walk around, during the op and whatnot. So I had my memang partner in crime that helped me with my language lah. I never learned Korean. I never enjoyed Korean drama until I went to Korea, right? So things change.
Okay, thank you, doctor. So next question, I have a question from I believe this is a preclinical student.
Hmm.
They were wondering how important is anatomy knowledge in surgery?
It's quite because it's quite. I think it's very important because if you have to relate the disease, you have to know the anatomy, right? But when in anatomy, when you do it in the first year or second year, it's very dry topic. Maksudnya you just baca hafal macam tu, right? Macam just for the sake of passing exam or whatnot. But then in surgery, because the anatomy relates to the disease and relates to the how we're gonna do the operation. And so, hence why you feel it's more practical and to know anatomy, plus getting use of it and understand the technicality behind it.
Oh, yes. Okay, thank you, doctor. I agree. Also, preclinical years anatomy are quite dry because you don't see the application of it. But once in clinical years, it makes a lot more sense. All right. So for the next question, this is from Hafiz. Doctor, may I know doctor's opinion on the parallel pathway MRCS and what are the differences with master program?
Okay. Now, so currently cut things short. So the master's program is the one that where we all the specialists get their special training in Malaysia. All right. Parallel program is currently the one that they are in the current agenda is actually for cardiothoracic and also urology, right? This thing is not new. It's been there for a long time, right? And most of the parallel pathway is international. They call it international exam lah. So because of people wants to affiliated with international name rather than local, isn't it? So because they always think that international is good or whatnot. But I can tell you because I train in all the regions in the world, right? Each of the region has its own specialty, right? Which for Malaysia, we got good because we have so many cases, right? Our cases are not the same as what you have in in Japan, in Korea, in UK, whatnot, right? So our our masters of surgery, even though it's not recognized in UK or in Australia or whatnot, right? But we know that we produce very good surgeons, good doctors, I mean, like sometimes more better, I mean, most of them better than from overseas, okay? Vice versa, same as well. This parent pathway, they also produce good surgeons, good doctors too. So for me, it's equivalent. Now the issue is more of the recognition part of it, right? Because when it started, there was not really like hard and fast rule about how is it done. It's more like MOU whatnot. But I think they will sort it out later on. So because if you go to as I mentioned, macam you go to Bangkok, training dia lain. You go to apa Korea, training dia lain. You go to Indonesia, the training is different. You go to around the world, you can see everybody has different type of training, but they still produce the same good doctors, right? So I I I believe that training is something that you don't stop doing. And definitely, each training program has its own pro and con, right? In whatever specialty there is. But I feel the more experience you have, the more it broadens up your mind, right? So you're very more skepticism about the program. And then the end of it, number satu is that where you want to end it up with. Because I know lots of people, they want to migrate. My friend wants to migrate. It's fine. So you want to migrate, you go for international exam, right? You take the international training or go overseas. Fine. For some of you feel that, okay, look, I just want to stay at home in Malaysia. So you try to enter the Malaysian program, right? Or some of you who feel that, okay, I want to go overseas first, and later on you come back as a specialist, dah sini, pun boleh, because NSR will recognize all these as training programs overseas, the certified ones. You janganlah buat macam sendiri-sendiri buat you punya training program, you pergi Paris kerja dekat this hospital, you pergi UK kerja kat this hospital US. It has to be what we call a certified training program under whichever the country is.
Okay, so following up to that question, there's also another question on MRCS as well. Is it compulsory to sit for MRCS exam as a credit before entering master program for surgery in Malaysia? Because from what I know, MRCS is not recognized in Malaysia. Is it true? Thank you.
It's not recognized, MRCS, but it gives a credit, it gives a merit for you to apply for the Masters of Surgical Training. And then in some universities, if you have Part 1, if you have MRCS, you're exempted from your Part 1 exam. I'm not sure which university now, but that's what during my time. So you're exempted because Part 1 Masters of Surgical exam is very, very difficult. So if you can get exempted, that's good enough. So meaning that you can sail through the 4 years of master's training. But it's not recognized because you have to understand. MRCS, kenapa dia tak recognized? Because it's purely exam based. Dia tak ada langsung macam assess you well clinical, tak ada langsung. Dia tak ada who assess you, who monitor you, who trains you. There's no standard. Macam you do not know whether you're going to be a good surgeon or not, because it's all on paper. So on paper, you boleh je tak apa-apa, right? No, it doesn't matter. But it's not ideal. So hence they only exam you from the Part 1 of masters. But then you have the FRCS, which is more fellowship, more advanced.
Okay. Thank you, Doctor. So, next question. Someone also asked, Doctor, can you help explain a bit about fellowship? Maybe in terms of maybe how is it different from other stages of training in medical, etc.
Okay, So fellowship is normally after you have become specialist, right? So rather than general specialist, so you want to do something more detailed, right? So for example, for medicine, right, you have neurology, you have your endocrine, you have your diabetic, right? You have your rheumatology, right? You have dermatology, right? You have apa lagi macam-macam, right? Medical, right? Because there's semua dah sub hematology, right? So for surgery, same thing. You have sub according to whichever. Like you have a neurosurgeon, you have breast endocrine, upper GI, colorectal, HPB, vascular, right? Trauma surgeon. And then for macam ophthalmology, they also have retina. They only have like somebody that only do PITS ophthalm, right? Somebody that only do ocular, macam very specialized. So each of these has its own training syllabus. So you have to go. So when you decide to choose, so they will tell you whichever the certified training syllabus lah. For in Malaysia now is for me for the general surgical one, the most of the sub training is going to be 3 years once you enter the program, right? Because tak semestinya you dah habis jadi specialist, you jadi kezaman, you kerja, doesn't mean you terus dapat buat fellowship if you want, right? Some people has to wait for their post. Some people get early, some people get quite late, right? So it's still and some people dah decide satu sub, lepas tu tak nak cancel, apply for another sub. Ada juga.
Oh, I see. Okay, so correct me if I'm wrong. So if you're for example doing a fellowship in colorectal surgery, then you would only be handling cases related to colorectal cases only.
No, because
Oh, no.
you already been gazetted as general surgeon. So you boleh buat semua general surgeon boleh buat, whatever you can do, right? Because that's why you have what we call NSR. NSR is National Specialist Registry. So those that people do the specific colorectal work cannot be done by those it doesn't have NSR in it, right? So adalah certain criteria. So but otherwise most of us already have a general surgical general surgery apa tu so we can do all these general surgical cases too on top of our colorectal case, but we're still on call general anyway.
Okay. Thank you, doctor, for the clarification. Next question from Jahiza. Good evening, Dr. Aini. What do you think are the characteristics that would make a good colorectal surgeon?
I think you have to have interest in it, right? It's not easy, right? Sometimes, and then even in colorectal now, there are many specialties. You can buat robotic surgery, you can do pathology, just fistula, hemorrhoid, right? You can do just a pelvic floor, right? You have to have a minat in it. I think that's the only syarat for me lah.
Okay. Okay. Next question from Yap Suk Woon. Good evening, Dr. Aini. This is a longer question. What are your thoughts on doing housemanship in university hospitals compared to doing it in KKM hospitals in terms of networking, getting recommendation letters from consultants, and securing a work position when pursuing master program in surgery or other specialties? Thank
Sama
you.
kan? Sama. If you're a good doctor, you're a good doctor no matter where you are.
Okay.
Boleh
So
hantar
I guess
so I kata macam Dr. Doldan tadi, you hantar this good doctor, you hantar di mana-mana pun dia boleh hidup. So it's not about where you train, who you train, who are you related to. But if you're a good doctor, you're a good doctor. That one you can't deny it. People will know who are good doctors and who are not good doctors, no matter where you're people, no matter where you are, right? Because I've worked in both. Because I see I have good doctors in university hospital. I have good doctors in KKM. I have good doctors even in because I work in like district hospitals. It doesn't matter. Doesn't matter. Of course, when you talk about trying to find the easy way to do your special to become to do your masters. But it's all number one, of course, it all depends on luck, right? Number two, if your numbers are good, meaning your all the paperwork are in hand, shouldn't have a problem.
Okay, so I guess that also answers the question of what do you think of doing housemanship overseas instead of KKM hospitals?
Now, if you do the houseman, but if you do the housemanship overseas, for example, people go to Australia or Singapore, kan? You just go there, stay there, live there. No point because definitely nak balik nanti dah susah. So you jangan fikir nanti because maybe you can come back bila you dah tua, bila you dah you dah apa? Bila you dah dah senior or whatnot, right? Because once you go overseas, you're going to enter their program, all right? So their program is only recognized in their place, right? Bila you nak balik tu memang jadi susah. So if you decided to go to do overseas, please do, but you have to understand, this is you choose to go out, meaning that you're not going to come back until when it's time to come back, right? So you choose that path, right? So no problem. It's no problem because it's just your own choice. You can choose, but to say which one is better for me is the same because the things that you're gonna katakan, for example, you go to Australia, if you go housemanship Australia, the cases that you see there is definitely different comparison to in Malaysia. So how I'm going to judge, okay, you're a better houseman because your cases are more difficult or whatnot.
All right, so at the end of the day, it depends on what are your long-term goals are in your career lah. So, all right, so for the next question from Milini Jane Pulit. Good evening, doctor. During your training years to become a surgeon, have you ever had the thought of giving up, and how do you convince yourself to keep going?
During my masters, because I failed I think twice. So I did. It's not that I want to give up. You feel bila you feel memang you rasa teruk semua kan. Tapi because when I feel to the I'm already in it for like 4 years, all right? And I feel that no, sikit lagi, just a bit more. This is the same feeling, especially the 5th year student. Sikit lagi, you just want to have one step, one leap je for you to finish it, right? So that's what keeps you going. And then because once you finish it, that's it. You can decide not to belajar anymore. Tapi doesn't happen. Baru habis, tiba-tiba sama belajar lagi. So yeah, you will have, but sometimes you're already halfway or you're already 3/4 way, just finish it up. Sikit lagi, tak ada. So you not start baru in other things, going to be difficult.
I see. Okay, thank you, doctor. So, following up to that, uh, in your perspective, in your opinion yourself, what makes being a surgeon or being in the surgical field unique to any other specialty?
There's not much because we deal with different things, right? So our scope is different comparison to ENT, comparison to vascular, comparison to eye, comparison to dentist. So there's nothing special because you deal with different disease. For us, the neurosurgeon do different things, pit surgery doing different things. So no, there's you can't say that one is better than other, because the cases are different. Of course, the complexity also different, right? But it's because it's equal vocal and equivalent because if you especially for us we get what we call the specialist allowance in Malaysia. Specialist allowance ni sama je, tak kisah whatever specialty you have, right? Tak ada kalau kata tak ada kata hepatology dapat rendah ke, tak ada. Once you're specialist, we call it NSR, a specialist allowance under government is all the same.
Okay, thank you, doctor. there's another question pertaining MRCS as well. I assume this is from a clinical student. Doctor, could you please explain further regarding the difference between MRCS and FRCS?
Yeah.
FRCS is just applicable to subspecialty, right? That's the question.
Okay, so MRCS is the basic entry point, all right? So so if you, because it's a UK exam, right? So if you have MRCS, so you complete your training in basic, but you're not gonna over there. You're not considered specialist yet, right? So over there in UK, especially because we talk about MRCS, but sebab negara lain tak ada buat MRCS ni, right? In just UK. So MRCS allows you to enter into what you call higher surgical training over the CCST. So the higher surgical training, CCST completion is a program for them. It's like their master's program, but they call it CCST. So they have this 6 years program that you have to enter. After you habis benda tu, then you go for your FRCS, then you become a specialist over there in UK, right? So it's much more longer than that. Yeah. This is the UK FRCS, but the one that and then to be qualified as a specialist in UK, you have to undergo the CCST, you have the FRCS, you are trained in UK. Comparison to people now, they ambil FRCS dekat luar, in Malaysia, in Hong Kong, in Australia. But these people are not trained in UK. They are trained like at Bangladesh lah, dekat India. So how do you know that their qualifications at par? So people with FRCS, international FRCS, who doesn't have CCSD, they can't go and work in UK. They can't. It's not recognized as, they're not recognized as a specialist. They can come as an MO or registrar, but they're not recognized as a consultant.
Okay, thank you, Doctor. I hope that answers the question. Okay, so I'm going to go to my last question. This is the final call for everyone who still have any question. Quickly type your question on the chat box. So for my last question from me, what are your specific, maybe some advices to the current clinical and preclinical UNIMAS students who wish to go down this path of specialty, or just generally any advice for them?
Okay, right. First, finish your exam. Okay, get your final professional set up. Then you're gonna do your housemanship. All right. Now, this housemanship will tell you the difference. Okay. Maybe some people, yes, they dah mati-mati by hook by crook, I'm gonna do surgery no matter what. Right. So these people, we can see they will excel in surgery because they minat, right? And then they will try awal-awal dah ambil MRCS lah, ambil semua tu, tak kisah, no problem, right? Go ahead if you memang that's what you really want, right? Some people happens to like it because masa buat surgery, or they have the best registrar lah, they have the best consultant lah, like what happened to me, isn't it? And then some people initially nak buat surgery, tapi tiba-tiba masa surgical ni dapat consultant daripada neraka, right? So they really, they said, look, they said, I don't want to do surgery, right? This all things can happen, right? This all things can happen, right? Or so, some people ada cerita, dia masuk surgical posting, dia jumpa boyfriend dia. So boyfriend dia buat surgery, dia pun nak buat surgery juga. So you choose once, once you're already that level, and then don't think that you kata I choose now, you're gonna be obligated to it. No. People, you still can change.
All right. So I believe that environment plays an important role in determining where we go afterwards down towards this career as well. All right, Doctor. Another question from the same person just now, from the question regarding MRCS as well. This person is planning to work in Malaysia in the future, but since MRCS is not recognizable in Malaysia, if they don't opt for university master program, is there other parallel pathway for us?
Macam mana? How is it?
Sorry. So the question was, this person plans to work in Malaysia in the future, but since MRCS is not recognizable in Malaysia, if we don't opt for university master's program, is there any other parallel pathway?
general surgery or Euro or cardiothoracic?
That's the question for this person lah. Which it depends on which subspecialty that you're looking for.
General surgery belum yang. But if Euro ada, Euro cardiothoracic ada.
I see, I see. Okay. All right. So, while waiting for this person to answer, we go to the next question first. May I know doctor's experience on how doctor develop interest in surgery? Can you help to explain a bit if you don't mind?
Ni lah, I told me masa I did my housemanship.
Mm.
Housemanship. Okay, so over there if we did housemanship just 1 year, right? So over there what normally happens is you're only given two, right? Surgical and medical, right? 6 months surgical, 6 months medical. Now, I started medicine first in Letterkenny dekat up north, dekat London there itu, right? So I worked with this consultant and Mr. Memang macam old guy, old English guy, memang all Irish guy lah. Memang very pakcik-pakcik, very, you know, I enjoy my medical posting. I really enjoy it, right? But you still do not know that about medicine part. Then after that, baru I went into surgery. So when I went into surgery, so I think I work with this. I think with the Mr. McCabe, the spine surgeon, or either all this vascular surgeon, this Sharif Sultan. These people treat you like, you know, you're their family, all right? They, especially for the vascular, vascular, this guy, Sharif Sultan, is an Egyptian, but work in UK. These people, they love to have very, very advanced cases, macam endovascular, all this. And as a houseman in vascular, you really have to be up to date. Macam you kena tahu blood HB berapa patient ni dah echo dia macam mana, like A to Z. So you have this book, you lari-lari with this file, right? So because the people is always in OT, so the people in the ward are managed by you. Because I know that I have to get this ready by the time they come to do round. So because of that, they notice that I really do my work well, right? So because of that, they also much encourage, you should do surgery or whatnot. I said, yes, I would, but I would not do vascular. So why don't you go under the surgical training first lah? So then that's why I went into surgical training. But plus at that time, it was easy to get job in surgery. So I think that one helps as well. I think that's all how it started.
Okay, thank you, doctor. Another question from Milini Jane. Hello, doctor. I have heard that as a surgeon, you need to basically sacrifice your work-life balance. What are your comment or opinion regarding this?
And I mean, that's very true, right? But your family has to be very understandable, right? Because for me, because I'm not married, so I don't have the commitment or whatnot. So it's just me and my career at the moment. So that's why it was okay. I think it was okay for me because I don't have to think about, I just tell that my mom I want to go for fellowship, or just I'm going there, here and there. So because I've been in and out for a long time, so there was no problem in terms of that. But it's difficult for people with family, with kids, because it is quite in the initial part of the training, it's quite difficult. So you really have to choose, and sometimes maybe this decision, maybe it's not just from you. You have to either you decide it with your partner, with your family. Sometimes what you want, it might not be what you get, right? So it's you have to decide well. Because if you're gonna do it, it's not just you, the whole family or the whole partner, the whole family has to understand that you want to do it. And then I've seen so many ups and downs of people with family members kind of with this.
Following up to that, I have a question. We always think that all this hardship, like you said just now, when you're going through training as maybe as medical officers, the hardships, one of the way to endure the difficulties are by thinking, oh, uh, uh, need to finish it like alang-alang like that. At some point it will be worth it at the end of the day. So in your opinion, because we always think that once we reach this level as a specialist, then maybe work-life balance is better, or maybe there's more time to ourselves. Is that true, doctor?
Okay, if your minat memang you die, you want to do it, all right? Doesn't matter whatever you choose, all right? You will enjoy it as you go along, all right? But if you kena paksa, you feel you're being pushed into it, all right? No matter what you do, it's not going to be successful, all right? So you really have to enjoy it and then embrace the whole journey to it. It's going to be ups and downs, not just surgery. You pergi mana-mana specialty pun, it's going to be ups and downs, right? Doesn't mean that surgery itself is difficult. Tak. Semua orang ada ups and downs, especially when you do further training or whatnot. Things that you need to sacrifice, So what at the end of it, it's just like, is that what you really want to do? And then you want to the ultimate plan is to finish whatever you start. That's all.
Okay, doctor. uh Next question. This is from Dahlia. Doctor, did you receive any sponsorship or scholarship when you pursue your masters and fellowships?
I'm a government from the moment I leave Malaysia until sekarang. I'm still government servant, guys. So berbaktilah kepada negara. Yalah, since lepas form 5, dah lah sekolah menengah pun sekolah kerajaan kan. You know, then form 5 and A level onwards, then GPA scholars. Until now, I'm also under GPA, right? Because we work, if you work under government, you're all under GPA, right? So born and bred. So I'm a government scholar from age of 17 lah. Tapi kalau hitung real is from the age of 17. 17.
So the JPA scholarship covers up until specialty training?
Government lah, government.
Oh,
Doesn't mean that JPA. Because even I went for my fellow under UNIMAS. It's under KPT, tapi KPT pun kan under JPA.
mm.
Sama je, bapak dia sama je. Kerajaan.
I see. Okay. Does anybody have any other question? We plan to end the Q&A session at 9:40, but if there's no other question, we can proceed with closing. I'll give about 1 minute.
Ada?
Any last question? Calling once, calling twice. Okay, I think there's no other question. All right, so ladies and gentlemen, I'm afraid we've come to the end of our webinar. On behalf of UNIMED, UNIMAS Medical Society, would like to once again thank our panel, Dr. Aini, for the valuable insights today, as well as everyone for joining us this evening. Before we say goodbye, may I ask everyone to please turn on your camera for a quick photo taking session. I'll give about 2 minutes, maybe. Set up your camera, your lighting, your background.
Dr. Aini,
Hmm.
maybe you can stop sharing the screen first.
Oh, sorry then.
Yeah.
Thank you.
Anyone else opening their camera? Technical team gonna take.
Yeah, I'll be the one taking the picture. Okay.
You'll be the one. Okay.
Yeah. All right. So everyone is ready, right? Okay. So just keep smiling. 1, 2, 3. Wait, yeah. Wait. Another one. Okay. 1, 2, 3. Okay. And maybe the last one, freestyle lah. 1, 2, 3. Okay, done.
Okay.
Okay.
All right. Thank you, doctor. So for everyone else, please stay for a bit. We have a QR. We will share a QR code after this for feedback of today's session. So we highly appreciate any comments on improvements that we can do for our future webinars.